introduction of Dr. Rimoin, I wanted to let you know from my perspective about COVID. So I am obviously not an expert. I am someone who has been somewhat skeptical about a lot of the information that has been presented to us. But one thing that I was telling our command, all of our officers, I recently sent out an email about COVID and about wearing masks and other stuff. And right now we're having a big increase in what we're calling maskless protests. So these are people that are going to businesses and malls and other places and purposefully not wearing masks and trying to really push their point of view. And while I have been skeptical in the past, one thing that I will tell you, and I'm going to read off some of the numbers from the department and from the division in terms of COVID, is that some people say that COVID is just like the flu. It's no different than anything else. And I'll let the doctors much more qualified to talk about that. But what I would say is that I've been on the job for 25 years in May. I'll have 25 years on the job. And there's never been a year that I've been aware of where we've lost 5 people due to the flu. So LAPD has lost 5 people in the last 12 months or less than 12 months. We've lost 2 sergeants, a police officer, we've lost a police service representative, which is a 911 operator, and a jailer, all to COVID. And that is something that I've just not ever seen. So for me as a layperson, while I've had my own doubts and skepticism, the numbers kind of speak for themselves. That kind of impact to those families is incredible. So from my perspective, not even understanding all the science, if the scientists are telling us that this may, doing certain things, social distancing, wearing masks, and et cetera, if that may minimize or mitigate the chances of spreading that disease that has caused us to lose 5 people just within our own department, then why wouldn't you do it? That's my perspective on it. So that's not based on any science or any specific knowledge. It's just, I understand that there's people that know more about a lot of things. I know what I know, and there's other people that know what they know. And so just from my perspective, having lost 5 people in less than 12 months to this disease, it's really been an incredible thing. And then I've talked about it myself. We almost lost one of our detectives. He was, Mike Chang was on death's door. They were talking about reading him his last rites. And had he not gotten the care that he had gotten at St. John's, he would not be alive and with his family. And so this is a significant disease. LAPD, we have approximately 13,000 people, not so much now because of the budget cuts. But we've had 2,421 confirmed COVID positives in the department. So that's quite a bit. And within West LA, we've had 40. Currently, I have 1 employee, I have 1 police officer who's hospitalized. He was diagnosed with COVID and he has pneumonia. He's battling through that right now. And I have, I think it's 9 other employees that are assigned home right now because they have COVID. So we're following the protocols and all those other things. But I'm just letting you know it's serious. It's been impacting our organization. I know that it's impacting the community as well. And so that's why I thought it was important to invite Dr. Rimoin here. She was so gracious to offer her time. And so thank you very much. And so now I'll get into this long, and I'll try to make it short. I'll try to read through it fast because she's so impressive with such a background, and she's really humble too. And anyway, so Dr. Rimoin is an infectious disease epidemiologist whose research focuses on emerging infectious diseases, particularly those that are crossing species from animal to human populations. She's a professor of epidemiology at the UCLA Fielding School of Public Health and Infectious Disease Division of the Geffen School of Medicine. She's also the director of the Center for Global and Immigrant Health. She's an internationally recognized expert on the epidemiology of Ebola, human monkeypox, and disease emergence in Central Africa. Her positions on COVID-19 health-related issues have made her an expert contributor to CNN, The 11th Hour with Brian Williams, and Real Time with Bill Maher. In print, her work has been featured in the New York Times, The Atlantic, Scientific American, Nature, and National Geographic, as well as more than 70 research articles and book chapters. She was recently inducted as a fellow. If you could just please place your microphones on mute, everyone. She was recently inducted as a fellow of the American Society of Tropical Medicine and Hygiene. She received her Bachelor of Arts from Middlebury College, her Master's in Public Health at the University of California, Los Angeles, UCLA Fielding School of Public Health, and her PhD at the Johns Hopkins Bloomberg School of Public Health. So I'd like to give her a big West LA welcome, and thank you very much for making yourself available. We're really fortunate to have you here, and I found her to be just a wonderful person and very open with all the information that she has. So thank you, Doctor.
Thank you so much, Captain Tom. I really appreciate it, and I'm so happy to be here. I'm so happy to help out and do what I can in terms of public service to be able to provide more information, because I really feel like this particular moment in time, information is power. And it's not always so easy to get information. I mean, literally, as I'm sitting here, I'm getting texts from friends and family and newspapers and press and everybody's asking questions. It's totally natural that we should be wondering about what's going on, and asking questions is appropriate and it's normal. And I think that there's the public health system here in our country has not been all that great at messaging, and but it's also hard to do it, and especially when you're talking about a new virus. It's normal that we don't have all the answers right now, and I think it's very hard for people to understand when there isn't always a clear answer, what the right thing to do is and how to message that appropriately. So I think the best way to do it is to have conversations about COVID, and to be able to just share where we are, share what we know, and be open about what we don't know. And I share my recommendations out of an abundance of caution, because I think being safer is better than being sorry in this scenario. I'm sure, it's one of these things. I always say my late father-in-law, Mo Clayman, always used to say, it's much easier to stay out of trouble than it is to get out of trouble. And I know that our West LAPD definitely agrees with me on that. It's definitely a good philosophy. It's my philosophy here too. And when there are things we don't know for sure, I think taking, additional measures to be more cautious is the right thing. So what I'm going to do is I've just compiled a list of questions. I sent them. I sent them out. These are the questions. These are kind of the questions du jour that I've been asked quite a bit about recently. And I'll just go through them and tell you, what I know, what I think, and we can, then go from there. You're free to ask me additional questions. Captain Tom gave me a very generous and kind intro. And I should also just let you know, so I'm the principal investigator of the study on asymptomatic infection and immunity and health workers and first responders. We've been doing a lot of work with LA County Fire Department. And we'll probably extend into LAPD soon. We're working with teachers. We're probably going to be working also with essential workers, because all of the people that are in our county and trying to keep us safe, we also want to be able to keep them as safe as we possibly can, and to make sure that we understand what's happening. I'm also running a study right now on vaccine hesitancy and how people feel about the vaccine, and what to try to really understand what kind of messaging we need to do and what information we need to get out to give people the right info to be able to make their determination about if and when they're going to get the vaccine, which I highly recommend. With that in mind, I'm just going to go through this little list of questions, and then if I haven't hit something that you're interested in knowing about, then we'll just cover it. So the first question that people have asked me a lot, and I've gotten this a lot on the news recently as well, is why has the pandemic been so bad here in Los Angeles? And I think there are many reasons for that. But I think one of the things that people fail to recognize about Los Angeles is what a complex city we have, how diverse it is, and that our county is actually the most populous county in the nation, and not by a small margin, by a very large margin. I mean, it's double the size of any other county in the US. So we have a lot of people. And I think that's an issue, but an issue. And so we have, a lot of geography here. We have density. So we have a lot of people, but we also have overcrowding, and overcrowding is a major factor here, because we really have so many people. Just given, we all know we live in West Los Angeles, so we know about the housing crunch and the fact that real estate is very expensive. And so for the people who don't have the benefit of being able to live in a large home, the vast majority of Los Angeles are living in overcrowded conditions. So multiple people sharing bedrooms and bathrooms and living space. And nobody lives in a vacuum. So even if you are lucky enough to be living in Beverly Hills or in Bel Air or in any place where you have, your own house and a lot of space, the vast majority of our Angelenos do not. And in fact, we score very poorly on this index of overcrowding. We have a very large percentage. And so you can imagine when somebody who's an essential worker comes home into that scenario, if they've been exposed, the virus just spreads like wildfire. And that has been a major issue, I think, driving it. We also know that a lot of these houses where people are overcrowded are multi-generational households. So we have young people living with middle-aged people and older people. And in that scenario, and people that are caretaking for parents, relatives, children. So, you have this multi-generational component to it as well, which I think really, it makes it very complicated. We also we've had an underfunded public system for a very long time in all aspects, in schools, in police force, in public health as well. And that's not just a situation here in Los Angeles, it's true everywhere. But when you start having this constellation of factors start adding up, you can see how it can snowball very quickly into something that is much more difficult. People also ask me, well, hey, we kind of knuckled down really early on in this pandemic, and we were able to really kind of get in front of things very early on. And that's true, but just given the nature of our city and our county, once a virus kind of takes hold, it can really move quickly. So I think that's one of these things that we've seen it kind of rip through communities that have some of these similar demographics. I mean, that's what happened in New York in the spring last year, and therefore it's just not really, unfortunately, not surprising to see that we were kind of a perfect storm for some of this. So in terms of why we're seeing such a large number of cases, that's probably it. Now, it's also very likely, we've had very poor viral genomic surveillance across the United States. It's not just a function of what's happening here in Los Angeles, it's across the United States. We rank, there've been a ranking of how well people have done in terms of sequencing, and Iceland is number 1, and UK, I think, is somewhere around number 4 or 5, and we're number 33. We're actually below Benin, where I was a Peace Corps volunteer in the 90s in West Africa. So we're really not doing a great job at sequencing, and that's also just a function of, it requires infrastructure and coordination and funding, and I think that these things will continue to improve over time. And we'll learn more. And I think it's very, very important to have this kind of sequencing information to really understand what kind of variants that you have circulating. Is it mutating? Are you seeing a dominant variant that is suggestive of more of being more contagious? And then really understanding the mechanisms behind that is important. So I think that we're going to get there. It's just that we're not there yet. We definitely do have some people have asked me, the other question that people have asked me a lot about are the variants and what's going on in terms of these variants, and are the vaccines still effective against them. So what we know right now is that there are 3 variants of concern right now that we're worried about in particular, and these are these variants are from South Africa, from the UK, and from Brazil. They all seem to be mutating similarly. They're becoming much more contagious, and mutations happen regularly. So it is not surprising that we're seeing these viruses mutate. To say these viruses are mutating is natural. Viruses will continue to spread from person to person. They'll replicate in one host. They may pick up some changes. Most of the time, these changes are not going to amount to much. But if you have enough transmission and enough opportunities for this virus to continue to be picking up new mutations, eventually it's going to evolve into something that's a little bit fitter, a little bit more capable of surviving. And the best way to survive better is to be more contagious. Now, when people ask me about why is it more contagious, we're still trying to understand that. There are 2 main reasons for it. One that we think is that people are going to be shedding more virus when they get infected with one of these variants. So you're going to, when you sneeze or you cough or you talk, you're expelling more virus when you have these particular variants versus the standard variant. And so, we are likely seeing that, but there's also the potential that these viruses are becoming more effective at entering the cells. And so that could potentially be one of the reasons why that these variants they're a little bit stickier. They're able to bind and insert into the cell a little bit easier. So those are the 2 reasons that we think that there may be some of this, what it may mean to be more contagious. So then the follow-on question is okay, we potentially have these viruses that are more contagious. So what now? What do we do about it? How do we protect ourselves better in the face of a more contagious variant? And that, or variants. And the answer to that is you got to double down on all of the precautions that you've been using so far. And so, for examples, it would mean you got to make sure you're wearing the right kind of mask and wear the mask correctly. So you should be wearing a 2 or 3 ply mask. And if you don't have good masks, or you're not sure about the quality of your mask, or if you have a cloth mask, I suggest you double mask if you can, if you must go out. I also recommend wearing a face shield if you can when you do go out, if you need to go out. I actually have a face shield right here that I often wear if I go out. I believe it's important to be able to not only cover your nose and your mouth, but also your eyes. And so, if you wear glasses, that's also great. You can wear goggles. I even wear these over my glasses when I go out, if I do need to go out. So having the best protection that you possibly can is a really good idea. You must wear your mask over your nose. I see people all the time wearing their mask like this. You have to wear your mask over your nose, under your chin, and it's got to be completely covering your face. It's got to trap in absolutely everything that you've got here, and it should fit snugly. So I see people all the time doing this or this. It's got to be very well fitted because the whole point is to trap in anything that you necessarily have any virus that you might, because everybody should act like they potentially have it, because 50% of cases are completely asymptomatic. So you won't know if you have it, and it's very possible, and you can spread it to others. But also then, to protect yourself, you want to make sure that this fits really well and has good filtration, so that it really does trap the particles. So if you ever see me anywhere, this is how you're going to see me. So this is really the best scenario. It's also about really doubling down on social distancing. We've talked about 6 feet apart. 6 feet apart is the minimum you should be. It is not the maximum. And it doesn't mean you're just safe because you're 6 feet apart. These virus particles can hang in the air. They can, it really depends upon where you are and the ventilation and everything else around you. So my suggestion is if you can be farther away than 6 feet, be farther away than 6 feet. 6 feet is a minimum, and that's all based on early studies that have nothing to do with COVID about droplets and the physics and the weight that can actually, where it will, these particles, standard particles, will drop. But in addition to that, there are some microparticles that can kind of float around and hang in the air for a period of time. And like I said, we're still learning about these viruses. It really does, it's going to depend upon a whole constellation of factors, the indoors, outdoors, the ventilation, is it, like UV light, there's a whole series of things. But my advice to anybody that I speak to is to make sure to do everything you can, because the cost of getting COVID and potentially spreading it to other people, even if you don't get very sick, is extremely high, and could even result in somebody's death. So I think it's going to be, I just think it's really important to think about it. So the things you can do, again, just do the absolute best you can with best PPE that you can get. Don't spend time indoors with people that are not in your household. Avoid crowds, really avoid distance, wash your hands very often, and avoid touching your face. That's also why I like these face shields, because it keeps you from touching your face. Now, the vast majority of virus is spread person to person from just breathing, coughing, talking, etc. But it is certainly possible, and especially with more virus shedding, that you could just touch something, and then you rub your nose, you rub your eyes, you touch your face. I mean, that's just, it's a very common way. And listen, it's very difficult for everybody. It's hard for me, somebody who's worked in a laboratory and that works on Ebola and works on all of these kinds of things. I personally, I do not go to the grocery store anymore, and it drives me nuts. I hate using services where somebody's going to pick my vegetables for me and get me the milk that doesn't have the best date of, I get it. I get exactly why it's a pain to use services right now. But if you have that luxury to do that, do it. Because you could be, the grocery carts, the picking things up, the aerosol, in the grocery stores. It's just, and it's hard to stay away from people. And even if you're trying to stay away from people, they don't always stay away from you. And then you've got checkout lines, or you've got, I think the thing is that anytime you go into public, it's hard to control your environment. So it's just better to avoid crowds, keep your hands clean, cover yourself if you do need to go out. The bottom line is, with these variants, there's no room for error when you're following these kinds of precautions. Like, our margin of error has decreased significantly now with more potentially contagious variants around. So the other thing I would say, of course, is the ultimate way to reduce risk is to get vaccinated. And I know that everybody is trying to get vaccinated right now, that can, and the supply will increase, but it's taken some time. I think that there are going to be some new plans put in place and some new opportunities with people who've spent their whole careers planning vaccination campaigns. I've spent years planning vaccination campaigns in the toughest places on the planet. They're not easy. And they're actually harder here because you can't just go into a village and just say, everybody just come out and let me vaccinate all of you. We have to worry about insurance, and we worry about, the cold chain, and we worry about, we're much more picky about people standing in line. And I mean, it's much more, the more rules you have around a vaccination campaign, the harder it is. And because we don't have enough vaccine, we have to be very, very judicious with it. So I just think that it's been a very, very difficult scenario to be able to make this all happen. So that's what I would say about the variants. I think they're just important to recognize. It just means we have to be so much more careful. Oh, I think somebody is not on mute.
Everyone, please look at your settings and make sure that your microphone is on mute.
There we go. Perfect. Okay. All right. So that's where we stand there. Do you want me to, maybe it's best for me just to stop and let people ask questions about what I'm talking. I mean, I've already covered two things, California and these mutations. Do you want me to stop and allow some questions at this point, and then we can keep going, or you want me to just go through my list?
Robert, would you be good with that?
Yeah, I think there is, well, either way is fine, because I think as the doctor goes down the list, I think there'll be new questions generated with some knowledge attached to it. So if it's up to Dr. Rimoin, but I think if she just continued, and I know, believe me, I know there'll be lots of questions after that. Are you comfortable with that, doctor?
Yeah, it's totally fine. I mean,
Yeah.
I'm very, this isn't one of my lectures, so I'm very,
No,
I want to make sure that I'm giving people.
Well, we're all very good students here.
You guys are all getting A's right now. I love it. So,
I think, Doctor,
Yeah.
Doctor, if you just kind of keep track of the questions that are going to be asked, we talked about this beforehand, Robert and the doctor and I, and it does make it a little more dynamic when people are asking live questions than you just reading a list of questions. So if we just kind of keep track between the three of us of the questions that were asked previously, we'll listen to the questions that are asked now, and then we'll try to circle back and answer any questions that weren't.
Yeah.
Is that fair?
No,
Sure.
that's fine.
Sure. What I'll do is I'll just kind of, because some of these are all grouped, they're kind of grouped into similar things. So I'm going to hit the high notes here, because I know we only have another 17 minutes. So what I'm going to do is I'm just going to talk about, okay, masks. Masks are very effective. I actually just published an article. I was just the senior author on a paper that came out in the Proceedings of the National Academy of Sciences. It's a review of masks. And what it really does tell you is we've reviewed all of the literature, looked at all of the data, and masks do work. I promise you they work. The better the mask you have, the better filtration system you have, the better. Again, like I like these KN95s are also, I think there's a new one from Korea that's also very good. I can't remember what the name of it is. Good Morning America just asked me about it just now, and I had, KF94s, also good. So KN95s and KF94s also very good. But you just want to make sure if you can blow through this and really be able to feel your breath, or like blow out a match, it's not good enough. So that's why I say, just make sure you have a good quality mask. I just get them on Amazon. People ask me, where do I get my masks? I just get them on Amazon. And for example, if I'm wearing a cloth mask, I wear a surgical mask underneath it, because then I feel like I've got double protection. Plus, cloth masks are kind of gross. That's a very scientific term, gross. You have to wash it every single time. So it's kind of like you can have, if you're wearing a a surgical mask underneath a cloth mask, that's better. So, so that would be, and then you throw out the surgical masks after you've used them. So I think that that's the key in terms of masks. Okay, the next thing is I'm going to talk a little bit about the vaccinations and what's going on with vaccinations. So the questions about vaccinations are, you know, should I get vaccinated? Answer, yes, get vaccinated. If you don't have severe allergic reactions to vaccines that you know of, or another concern, medical concern, and if you do have a concern, talk to your doctor. That is the best thing that you could do. Don't talk to me. Don't talk to your hairdresser or your neighbor about it. Talk to a medical professional who can guide you specifically, because they will be able to tell you, is the allergy you have somehow or another going to impact you? I think that that's really important. That's the best advice I can give people, is really just talk to a medical professional about it if you have concerns. And most people should not have concerns. I was vaccinated 2 weeks ago with the Moderna vaccine, and you know, my arm hurt for several days. And you know, I'm not going to kid you, it hurt a fair amount, but it hurt about the same as the shingles vaccine did for me. So I equated it exactly to the shingles vaccine. So, you know, you want to make sure you move your arm around a lot and kind of get it, you know, get it around there. It just, but you know, my arm hurt. That was the only thing that I had. And frankly, I'd rather have my arm hurt than get a severe case of COVID, or to be, you know, to reduce my risk of getting COVID. Now, the next question that people ask me is, well, how long is this vaccine going to be durable? We don't really know the answer to that. And some of what's going on with these variants right now may change that a little bit. Moderna thinks that if all is well, it could last up to 8 months or a year. That would be under ideal circumstances. We'll know more over time. But the less virus we have circulating, the less opportunity it has to continue to mutate, the better off we are. So the sooner people can get vaccinated, the more we can kind of cut down viral mutation opportunities and spread in the community, the more efficacious the vaccine is. So it's like a whole circle, right? You want to prevent the spread of the virus so it doesn't mutate more and become more contagious. And how do you do that? You get vaccinated. And how do you prevent having to get a new vaccine? You get vaccinated, so you reduce the spread of the virus. It's a cycle. You know, the good news with these mRNA technologies, these new vaccines, are that they are very easily tweaked, updated to be able to adapt should we see a variant being, you know, becoming, you know, that the vaccine is less effective in terms of protecting against certain variants. Moderna and Pfizer said it could be 6 weeks and they could have a new vaccine to market with it, or, you know, in production. And of course it'll take time to produce. But the other thing I would say is, even as we see these new kind of mutations, I wouldn't worry. The only thing you do is just be more careful about it and to get vaccinated as soon as it's your turn to get vaccinated. It is very likely, given the fact that we're seeing this virus mutate regularly, is that we'll probably have updates to vaccines over time. And so it'll be like the flu and the flu vaccine, and why you get the flu vaccine every year, because then you're going to have new strains. And so, you know, the flu vaccine, I see out of the corner of my eye, somebody's asking me, why is it so short? Many vaccines are this short. It's a very different kind of a virus, and these kind of respiratory viruses can be, you know, and viruses that mutate quickly, like a coronavirus, require new you know, updates to your vaccination. So a perfect example, the flu virus mutates very quickly, and so that's why we're constantly updating and having to protect ourselves against new variants of the new strains of the flu. And you know, flu vaccines are really only good for about 6 months. That's why there's always this game of, when do I get my flu vaccine? I want to get it too early. I don't want to get it too late, because I want to have optimal immunity for the beginning of flu season to the end of flu season. And so that's why there's always this big rush in September and October to get it, so you have it just long enough to be able to protect you through the next time. But a flu vaccine is only around 40 to 60% effective in preventing infection. And so these vaccines are significantly more effective. But like the flu vaccine, what we say is that it's very likely it's going to prevent severe or even moderate or symptomatic disease. And that's often what happens with flu. You know, people will say, yeah, but I got the flu after I got the flu vaccine. Well, you probably didn't get the severe version that you would have gotten had you not been vaccinated. Flu vaccines prevent severe illness and death. And I can also see out of the corner of my eye. I don't know who has died from flu this year, but what I will say is the protective measures that we're taking right now, the wearing of a mask and the hand hygiene and the social distancing, has crushed the flu, crushed it. But that also tells you how infectious this virus is. All the measures that we're taking are just annihilating influenza. We're not seeing influenza spreading rampantly. I do know, I advise a couple of productions in Georgia, and there were some confirmed cases of influenza. I really don't know. I haven't looked at the flu data here in LA County. And so I do know that there have been cases of influenza, but it's so low. I mean, it's minimal. And so I think that's a really great, that's a great sign. Let's see, I'm gonna just see here, the questions about how we would reach herd immunity. That's kind of the next big question here. Oh no, wait, the next question is the effect of vaccination on transmission of disease. And here's something really important. I just wanna highlight this here because I think this is a point of confusion. So it's gonna prevent severe disease. It was really great at preventing these vaccines that are available, great at preventing severe disease. We don't know if it is going to prevent you getting it at all, and maybe you have an asymptomatic infection and then still can transmit it. We don't know. And the reason that we don't know, it's just not how these studies that were put up, you know, to get maximal impact as soon as they can. It's just not how the studies were designed. But we will have data on this, and we'll have data on it soon. But so out of an abundance of caution, that's why we say no matter what, you've got to be really careful. And I also want to caution people that these vaccines take approximately 6 weeks from the time that you get injected until you have protection. So you cannot, under any circumstance, let down your guard after you've gotten your first dose of vaccine. Be cautious at all times. You are just as vulnerable until you get that second dose, and then about 2 weeks later until you have optimal immunity. And no vaccine is 100% perfect. So it doesn't mean you get to, you know, we're all going to be like, you know, partying in the backyard next week. That's next year. All at Captain Tom's house, I think, is the story. Just seeing if he's listening to me here. So, okay, the last few questions that I'm gonna, because I know we only have a couple more minutes here. So herd immunity. It's gonna depend upon these new variants that are circulating. If it's more contagious, you need more people vaccinated. And so it's going to depend upon how these variants become established here, and if they make it harder, and how many people get the vaccine, right? So, so herd immunity, we anticipate could be anywhere from 70 to 95%. For measles, you need 95% because it's so contagious. This virus is not as contagious as measles. So this is like we don't know yet. We'll see. So we're going to wait to see that. And then I would say, when will things go back to normal? Beats me. But what I hope is that as we see more people vaccinated, that we will have a better opportunity to get back to normal. I mean, if I were just to, and this is like a crystal ball kind of, you know, I don't have one, but I'm just gonna, you know, people always want to know what I think. It's going to depend, you know, what happens again with these variants, how people get vaccinated, and how fast we can push down these surges of the virus. My hope is that we're really going to see cases plummet when we start getting, somewhere around 40% of the population vaccinated, maybe 50%. We could see a huge decline in the number of cases. And then, if these vaccines work as well as we think they're going to work, and they do protect against severe disease and death and hospitalization, then our hospitals will not be getting overwhelmed. And then we may be back to normal sometime in the summer, fall. But I would say by the end of this year, I think we'll be back to normal. And it really just depends. And I think that that's what we all have to be transparent about, is that it's going to depend on so many factors. Nobody is going to be able to tell you today what that's going to look like. But I think that we will have masking and social distancing for a while.
Doctor, can I just jump in for 1 second?
Sure.
Captain, can we extend the meeting? I know we like to end at 3, but we haven't even got to questions yet. Can we go a little longer?
Yes, I think it's appropriate. It's an important topic.
I can give you guys an extra 10 minutes.
10 minutes.
So I'm done.
Right into it. Let's go.
I'm
Okay,
done.
yeah, just go. Yeah, I'll give you 15 if the captain doesn't object.
So I only can go until 2:10 because I have another meeting at 2:15.
The first question is, I heard what you said about masks, and I wanted to know, would this be appropriate?
No, it's not appropriate, because underneath you've got the underneath. So no.
Oh, I don't like that answer, but okay, I accept it. You're the expert. Okay, go on with the real questions.
But I would recommend wearing that anyway. Other questions?
May I ask a question?
Yeah, okay, we'll start with Verdi, and then just kind of either raise your hand or unmute yourself, and we'll try to do this in an orderly fashion. But I think the doctor laid out a list of questions that I circulated in my last email, and I think she touched upon all of them. The only one that probably is the one that Stephen emailed me, but you'll have a chance to ask that question again.
So the question is,
right after Verdi. Verdi, why don't you ask your question?
Can we have a link to this presentation, to the video of the presentation, so we can review it more times and share with the family?
Yeah. Well, the sergeant, I think we did record this. This entire session has been recorded.
Yes.
But can we get them, if somebody requests them, can I send them to it?
Yeah, I should be able to send that to you, Robert.
Okay, good. So if you request through me, I'll get the, it's not a link, but it is a rendition of this session, and I'll get it to you, Verdi.
To request, send an email to you, or how?
Yeah, or text, either way.
Okay.
You have both. You have both.
Yes.
So I know. Okay. Okay. Question. Stephen, you had a question.
Yeah, thanks, Robert. Dr. Rimoin, I'm concerned about the number of people that are not getting vaccinated. It's been reported in the news, a number of firefighters, and I ran into somebody the other day that's highly educated and highly intelligent, and nope, not interested. And I'm concerned about how that affects the rest of us over time.
Well, that's a really good question. And so, as I said, I'm actually leading a study of vaccine hesitancy in a variety of different populations. That's been one of the things that I've been working on for years in places like the Democratic Republic of the Congo, where I've been running a research program for 20 years. And so our study, which is about to be published in the Annals of Internal Medicine, just like in the next week, it just took, these publications take a long time to get up, but it's actually already on preprint out. Is that what we found was that when we asked people about why they were hesitant about the vaccine, it was for health workers in particular, it was the speed of the development, the politicization of the process, and the lack of information that was out there. But then what we found is when the phase 3 data came out, because we're doing this, we're continuing to, we're hoping to be able to continue this research, funding dependent, but we hope to be able to keep tracking it so that we can do better messaging and be able to get more information out there. It flipped. So it went from only a third of people being willing to take the vaccine, to then 2/3 being willing to take the vaccine after the phase 3 data came out. And now we've just sent out our new questionnaire today to really find out, okay, well now who got vaccine and who didn't. And in LA County Fire Department, the numbers were actually not that different from health workers. And it was kind of these same reasons. And so I think that one of the things that people are saying, we have this problem here in Los Angeles County anyway. We have a lot of vaccine hesitant people in general who don't really understand the science of vaccines and are nervous about vaccines. And the public health community has been terrible at messaging this and really answering the questions that people have about vaccines. And so I think that my hope is that there's going to be a lot more detail, a lot more attention paid to the details of why don't people want to get vaccinated, and then to be able to have good public health campaigns that can actually answer the questions for people and have discussions with people and engage people in dialogue. And that's actually what I'm trying to do. Is I'm doing this with every group that I can to be able to provide more information. I'm also trying to do this with a bunch of different celebrity influencers so I can reach different populations, because I think that people listen differently to different people. You might listen to me differently than you might listen to Captain Tom, and not just because he has a gun, but because he's just but you'll listen to me differently if you live in a different part of the country, right? So it's having different people being able to message these things and to be able to answer questions and to be able to kind of resonate with people. I think that the other thing is as we see more people get vaccinated, that people will change their stance. So it's not like a static thing. I think that you have an answer today, but that answer could change tomorrow. If you see enough people get vaccinated and there are no problems, now you've had 16 million people immunized, very few allergic reactions, no deaths. Just, these are just in our own country, not just everywhere. I just think that it becomes a groundswell, and you'll see people kind of falling in line over time. So I think that the early stages of people being hesitant, I think we worry a little bit more about it than we actually need to. So I think it's going to be very important.
Maureen Smith has her hand up, and then Judy Hewlett.
Yeah, you've been absolutely great on MSNBC and CNN. You're very, very clear in your answers, and I really appreciate that. But I have an appointment on Tuesday, and I'm really sort of scared. And is there anything that I need to be aware of why I should not get the shot?
Okay. So I just wanted, because I saw somebody say, okay, there have been deaths. The deaths that happened in Norway were actually ruled to not have been directly a result of the vaccine. That's after investigation. I know, listen, we're all concerned, and it doesn't mean that there won't be some, but right now we don't have data that suggests that there have been, and if there was a significant, with the millions of vaccines that have been allocated all over the world and in arms now, I feel even more secure today than I did the day before. These are reasonable questions to have, by the way, and it's always important to have these discussions. It's also okay to be nervous, but I think the real deal here is that you have to think about the risk benefit, right? And the risk of getting COVID and potentially having a severe outcome yourself, or somebody else you love, or somebody else you don't even know because you were part of a transmission chain, that it's much better to get that vaccine. The probability of an adverse event is extremely, extremely low. And these technologies, while we talk about these as new technologies, we've been working on mRNA vaccines for 20 years. This is the first one that's actually made it through the pipeline because it had an effective target, but the technology is safe. The technology it's revolutionary. There are going to be many vaccines are going to be mRNA vaccines going forward. It just, at some point you have to kind of get through this. But that was true with subunit vaccines and with all the other vaccines that we've had. So, so I think that it's just one of these things where we just, everybody, I totally understand being nervous. And I would be lying to you to say that people wouldn't be somewhat nervous about it. It is new, but you weigh the risks. And it's not just about getting COVID and being, well, I kind of got off scot-free. We know that there are these uncharacterized clinical syndromes that exist out here, these long hauler syndromes. And while not everybody, there are a lot of people that don't die, there are a lot of people who've had very severe long-term outcomes, limbs amputated, lung problems, after the fact, strokes. I mean, there are many long-term consequences that you could potentially have. So I, as somebody who I understand, there's nothing without risk. You're taking a risk getting this virus. I mean, in principle, you're probably taking some risk getting a vaccine. There's nothing that's going to be zero risk. But in my estimation, and in, I think many people's estimation, the risk is much greater getting COVID.
Makes sense. Thank you.
Okay. Thanks for your question. Judy?
Yeah, I have a PhD in public health, and I've studied transmission and that, especially across borders. And so I think when I'm having conversations with people, one of the things that helps so much is to reposition that this vaccine is different and that they can then become an ambassador to others. And really that spreading that message and their experience is always, it's for the most part going to be positive, except for the hurting arm. They're going to be able to spread the message differently. But I think the understanding that this vaccine is really designed and manufactured differently than other vaccines. And you're right about the messaging. It's just been horrible. They've let all of the past sins of vaccines spread, and the media is being no better as far as trying to help people understand this. And so I concur, and I really appreciate your approach on this. It's you're saying all the right things. It's just people have to begin to listen and try to understand it. And I think with the vaccine program, they'll actually see the experience backing that up.
Well, I think that thank you for that comment. And I could not agree anymore. And I did a quick search here. The first thing I see is you publishing with two people who were my mentors, Osman Galal and Charlotte Newman. So I see your background and I see you and I agree with you entirely. And I think that the more we can do to be able to message and to be able, but it's tricky messaging, right? Because it isn't just as simple as do this and that will happen. And we've never been good in public health at dealing with vagaries or with any kind of ambiguity. And that's why I think that the anti-vaccination problem has proliferated, is because we haven't been as good as we need to be, and we need to get better, and we need to be less stilted, and we need to be having more of these kinds of conversations. And it's different to have a conversation than it is just a public health message that rhymes or some, this is a whole new way of trying to message people. And, I was part of the Ebola vaccination program. I'm still evaluating the Ebola vaccine in DRC. And I mean, that was a completely new vaccine. I got vaccinated in the field in the Congo in the middle of an Ebola outbreak. And I was nervous, but I felt the risk merited getting it, and that the risks were so low. You take a risk every day getting in your car, you take a risk every day, doing many things. And that's not to negate the how scary it is for people. But it's much scarier to be facing COVID.
It is, but this approach is so different. The mechanism is different. The design is different.
I think we're going to take, thank you. There's two questions. One I saw, is it Leanne Sanderson?
Yes. Yes, thank you.
Okay,
thank
and
you.
then
Can you hear me?
and then the one other question after that, and then the doctor has to run, and we'll switch back to the captain. So first Leanne, then Irene, and then we'll wrap it up. How's that? Okay, Leanne?
Sounds great. Thank you. And I did order I was inspired and I ordered my face shield during your session. I haven't owned one, and you completely sold me on it. So our family 3 out of 6 of us had it in March, COVID, and my son's gone off to college. He's with all these 19-year-olds who, you know, all over the country, they got COVID and they were all fine because they're young, healthy, and they're fine. So more on that spectrum, my question is, do they need to get the vaccine? And are they doing it to be fair? Are they doing it to protect me and older people? Or are they doing it to protect themselves when they know that it was nothing for them? And in the sense that they did get it, is there something when your body fights COVID that helps you long term for COVID-25 that you might be more ready? So that's my question.
So that's a multi-part question. And what I would say is, like, so the bigger thing is that even if you've gotten COVID, you should, if you're more than 90 days out, the recommendation is to get the vaccine. The next thing I would say is that there are some cases where your immune response from a vaccine is actually better than having had the infection yourself. We don't know what it is at this point. We just don't know. There's no good answer for that today. And so, you know, but with new, what I would say is that, you know, the immune system is multifaceted. You know, we know we're seeing antibodies wane. There was just, I mean, every other paper you see, people have antibodies for a long time.
Mine's waned a lot. You see, I have given convalescent plasma and UCLA has tracked it and it's waned. I mean, it's, you know, they don't need it for patients anymore, obviously. Yeah.
Right. But there's also, you know, I mean, but there's also your T cell response, you know, there are other, the immune system, you know, is a village. And so it just depends which part of the village is activated at that moment. But the antibodies are the ones that we can see really well, you know, with some kind of easy testing to be done. So really the jury is out. We don't know yet. Okay. But what I would say is, if it were me, I would get vaccinated.
Okay, we got.
And you would have your 19-year-olds all do it.
I absolutely would, because that will potentially boost his immunity. And also, as we, you know, as I said, you know, with having a previous infection, we really don't know how long that immunity lasts. And a boost is not a bad thing. Boost is
okay, we have one more question from Irene. One more question, because it's already 3:12, from Irene Sandler, and we'll keep it short. And then we'll move on, so you can move on to your next mission.
Question is
Go ahead, Irene.
The question is about food and cooking. If one has the vaccination and then is shedding virus, can that person cook for their family? And if the virus is spreading so dramatically, what about picking up food or having it delivered?
Okay. I think what I understand, let me make sure I understand from what I understand your question is, if somebody is actually sick with COVID, can they cook for their family? No. If somebody is sick with COVID, then they need to isolate from their family completely.
But if they have the vaccine and they're shedding virus, but they don't know how long.
Okay, so this goes back to Judy's question, which this is a very different kind of vaccine technology, and I unfortunately don't have time to get into it. But what I will say is that these vaccines are not live viruses, so you're not getting an attenuated form of COVID and then shedding the virus. This is basically, it puts like a little protein into your body that basically sends a message to your cells to be able to develop antibodies, and then that protein degrades over a couple of days and is gone. So it's kind of like, Tony Fauci had a great example of, it's like a Snapchat. So it's or a story on Instagram or Facebook, and it goes away after a while, but it's going to leave an impression. It's going to keep eliciting a response from you. I see Judy nodding her head, so I'm hoping this is a good, I'm trying to work my new way of being able to explain this to people over time. But that's the genius of this new, this novel technology that's finally being used, is that it's not reliant on another virus that either they're using, you know, they make a boiled down version of it or use a piece of the virus to be able to get it into your system. This is not a virus at all. It's just making your body make these antibodies, which is really fantastic and a much safer way to get a vaccine.
That's really very clear. Thank you.
We're going to wrap this up. It's already 3:15.
Right. I'll do this 1 minute. Yes, better to order out than not. And then you're also supporting places. I would just, just wipe down your stuff or leave it out, for a couple of minutes. But I'm really not worried. I'm more worried about the person-to-person transmission. Let somebody leave it outside your door, let it sit for a couple minutes, and then bring it in. And you can wipe down your stuff. You don't have to be crazy about it. You just like I said, vast majority, you don't want to spend 90% of your effort on preventing 10% of disease. You want to spend 90% of your time preventing 90% of the disease, which is this aerosol part of it, and just kind of wipe things down. Okay.
Okay, well, you've got to run. We wanted to thank you, and I wanted to ask you if all of you here have specific questions for the doctor, can they email me and I can forward them to you? Would that work
Mr. Ringler,
for you, doctor?
May I ask you for the doctor to share her contact information?
Well, no, I gotta move on. The doctor has to leave. Yeah. No, I got your question, Renaud. Discuss that with the doctor and the
Robert. Thank you, and I think that
okay. Anyway, thank you for joining us. We really appreciate it. And nice hand effort and
thank you.
And being educated is science over politics. I think we all agree to that.
I'm happy to help.
Thank you.
I'm very appreciative of everybody's time. Please, everybody stay safe. And my message to everybody is just do your part. Please do your part, because everybody can make a difference right now. It feels like you can't, but you can. And that difference is really avoiding no outdoor dinners with other people, none of this. We're in like the home stretch here of the worst part of this pandemic. So if you can hold out for the next month or two until we start seeing more vaccines in arms and we see these surges going down, you're not only doing a service to yourself and your family, but your entire community. So that's my last message to all of you. So thank you so much.
Thanks again.
Thank you.
Okay, I may be emailing you some questions.
Sure,
okay.
No problem.
Okay, I'm going to turn the meeting over to the captain.
Okay, thank you.
Are you related to David Rimoin?
Yes, David Rimoin is my father.
Okay. I was in his department many years ago.
Oh, well, David Rimoin was
small
my
world.
dad.
Thanks for sharing, Jerry. That's very interesting.
Thank you.
Wow.
Thank you again.
Bye.
Bye.
So I just want to be respectful of everyone's time. I appreciate the time and attention. I hope you guys got something out of this. I know that I did.
This was great.
Yeah, if we can get speakers like this, I think it just gives everyone an opportunity to hear a different perspective. And if you could use your platforms, every single one of you has a platform where you can reach out to, some of you are thousands of people, but even if it's your neighbors on the left and the right of you and across the street, and just kind of pass along some of this information, I think it goes a long way to help educate, our neighbors and our community. And that's really what we need right now. I agree with Robert's statement that, it should be about science, not politics. The politics has nothing to do with this. We just want to save lives and try to just make everyone safer.
Yeah, I think that's the goal.
Yeah. So just real quick, what I wanted to let you know is, there was a question about calling 911. There was an incident, I think it was in Westwood Hills, where a letter had gone out to the community about this woman who was saying that she was accosted by a transient, and that she called 911 and then she got transferred somewhere. We have been trying to research this piece of information. We can't get a hold of the person who wrote that original email. She is not contacting us back. If someone has that information, I don't want to get into a big discussion about it, but they can contact me directly or Robert, and he can get us that contact information. But we have the person's phone number. We've made attempts to contact her, and we've been unsuccessful. But what we do know is that there was no, we don't have a record of a call for service in relation to that particular call. So what I would just kind of to educate you, when you call 911 from your cell phone, depending on where you are in relation to the cell tower, or if you're near a freeway or whatnot, that your call to 911 may get sent directly to the CHP dispatch. Generally speaking, when that happens, they have to ask some screening questions, and then they will transfer the call to the appropriate jurisdiction. So that's kind of, it was set up that way a long time ago, because from a cell phone, they don't know where you are. And so it depends on if they have the ability to ping your location and determine where you are exactly, then they can dispatch appropriately. But generally speaking, if it goes to CHP or whoever it goes to, they're going to screen you to try to determine, is this a true emergency? And if it is, then they will dispatch to the appropriate entity. If LAPD gets that call, and they do sometimes, depending, again, I was told, depending on where the cell towers are and where you make your phone calls, the call may go directly to the LAPD dispatch. They still are required to ask a lot of questions to determine whether or not